Thyrotoxicosis. What is thyrotoxicosis? Thyrotoxicosis is defined as the state of thyroid hormone excess. State of excess thyroid hormone. Causes of thyrotoxicosis: Graves' disease, multinodular goiter, Graves' disease, multinodular goiter, Graves' disease, multinodular goiter, solitary thyroid adenoma, thyroiditis. Thyroiditis include subacute dequervance and postpartum. Subacute dequervance, which is painful virus. Thyroiditis includes dequervance, that means painful virus induced transient inflammation of the thyroid gland, and postpartum. Iodide induced, it includes drugs, radiographic contrast media, and iodine supplementation program, and iodide supplementation program. Number 6, extrathyroidal source of thyroid hormone. Extrathyroidal source of thyroid hormone. Extrathyroidal source of thyroid hormone includes factitious hyperthyroidism and struma ovary. Number 7, TSH induced, TSH secreting pituitary adenoma, choriocarcinoma and hydatidiform mole, then follicular carcinoma plus metastasis, or with or without metastasis. Clinical features of hypothyroidism. Clinical features: symptoms and signs. Symptoms include hyperactivity, irritability, and dysphoria. Number 2, heat intolerance and sweating, palpitation, fatigue and weakness, decreased weight or weight loss with increased appetite, diarrhea, oligomenorrhea, loss of libido. More includes muscle weakness, tremor, emotional liability, anxiety, psychosis. Signs include exophthalmos, lid retraction or lag, tachycardia, atrial fibrillation in the elderly, then tremor, hypertension, goiter, warm moist skin, muscle weakness, proximal myopathy, pretibial myxedema. Investigations for thyrotoxicosis. Specific investigations and non-specific investigation. Specific investigations include serum T3, serum T4, both are increased. serum TSH decreased or undetectable in non-specific and specific and non-specific test investigations. Specific investigations include serum T3 and serum T4, both are increased. Serum TSH decreased or undetectable in primary thyrotoxicosis and raised in case of secondary thyrotoxicosis. Example, TSH secreting pituitary tumor. TSH secreting pituitary tumor. Number 3, thyroid autoantibody. Thyroid autoantibody, antibody to TSH receptor. Antibody to TSH receptor. Number 4, isotope scanning. Isotope scanning. Non-specific investigations include ECG, serum enzymes. 3, bilirubin. 4, calcium, serum calcium. 5, glucose, urine glucose. ECG shows sinus tachycardia or features of atrial fibrillation. Serum enzymes: raised alanine aminotransferase, gamma glutamyl transferase, and alkaline phosphatase from liver and bone. Serum enzyme: raised alanine aminotransferase, gamma glutamyl transferase, and alkaline phosphatase from liver and bone. Bilirubin level increased, mild hypercalcemia, and urine glucose, glycosuria. Associated diabetes mellitus and large storage glycosuria. Treatment options include: number 1, antithyroid drug. Antithyroid drugs. Number 2, subtotal thyroidectomy. Number 3, radioactive iodine. Number 4, symptomatic treatment. Antithyroid drugs, subtotal thyroidectomy, radioactive iodine, and symptomatic treatment. Antithyroid drugs: carbimazole and propylthiouracil. Carbimazole and propylthiouracil. Carbimazole 40 to 60 milligram daily in 3 divided doses. There is subjective improvement within 10 to 14 days. There is subjective improvement within 10 to 14 days, and the patient is usually clinically and biochemically euthyroid at 3 to 4 weeks, when the dose can be reduced. Maintenance dose is determined by measurement of T4 and TSAs. Carbimazole can be continued for 12 to 18 months. Carbimazole can be continued for 12 to 18 months. Propyl thiouracil 400 to 600 milligram daily. There is subjective improvement within same as carbimazole 10 to 14 days, and the patient is usually clinical and biochemically euthyroid at 3 to 4 weeks, and the dose can be reduced. It is safe in propyl thiouracil. It is safe in pregnancy. Next option, subtotal thyroidectomy. Patient must be rendered euthyroid with antithyroid drugs before operation. So patient must be euthyroid drugs before operation. Potassium iodide 60 milligram 8 hourly orally is given, added for 2 weeks 2 weeks before surgery to inhibit thyroid hormone release, reduce the size and vascularity of the gland, reduce the size and vascularity of the gland, making surgery technically easier. Radioactive iodine 131 iodine is administered orally as a single dose and is trapped and organified in the thyroid. Symptomatic treatment include a non-selective beta blocker propranolol 160 milligram daily, or nadolol 40 to 80 milligram daily will alleviate but not abolish symptoms in most patients within 24 to 48 hours. Verapamil may be used as an alternative to beta blocker. Verapamil may be used as an alternative to beta blocker to reduce palpitation and arrhythmia. Example, in patients with asthma. Now, treatment options for thyrotoxicosis. These treatment options. Definitive treatment of thyrotoxicosis depends on the underlying cause. Indications, contraindications, and complications of different treatment modalities of thyrotoxicosis. Comparison of treatment modalities. Definitive treatment of thyrotoxicosis depends on the underlying cause and may include antithyroid drugs, radioactive iodine, and surgery. Antithyroid drugs, example, carbimazole and propyl thiouracil. Common indications, then contraindications and complications. Indications: first episode in patient less than 40 years. Subtotal thyroidectomy indicated when large goiter, poor drug compliance, especially in young patients, poor drug compliance, recurrent thyrotoxicosis after course of anti-thyroid drugs in young patients. Then radioiodine indicated in patients greater than 40 years of age is recurrence following surgery irrespective of age recurrence. Then other serious comorbidity contraindications of uh, anti-thyroid drugs. It is contraindicated in breastfeeding. Carbimazole is contraindicated in breastfeeding, but thiuracil is safe. Subtotal thyroidectomy contraindicated in previous history of thyroid surgery. Then dependence upon voice, opera singer and lecturer. And radioactive iodine indicated contraindicated in pregnancy or planned pregnancy within 6 months of treatment. Then active Graves' ophthalmopathy men also advised against fathering children for 6 months. Men also advised against fathering children against fathering children for 6 months. Complications include anti-thyroid drugs, hypersensitivity, then rash, agranulocytosis. Subtotal thyroidectomy includes hypothyroidism, transient hypocalcemia, permanent hypoparathyroidism, and recurrent laryngeal nerve palsy. Radioiodine complications include hypothyroidism, then exacerbations of ophthalmopathy. Important complications of thyrotoxicosis. Important complications complications. Important complications includes heart, atrial fibrillation, heart failure, hypertension. And another complications, thyrotoxic crisis and Graves' ophthalmopathy.